This is so strange because I'm staring at my screen and I can't see anybody, but I'm going to keep talking into my camera. So I just have a couple of slides that I put together just to kind of describe what I do and kind of how I got to where I'm at in my career. And then I think we're going to do questions, right? Is that how you usually do this?
Yeah, we'll have some
Yeah.
questions at the end.
Okay, great. So okay, so I just did a little summary. You probably already know this because I know you have doctors speak to you all the time, but I did a little summary of my training and kind of training in general. So you probably know that in order to go to medical school, you need a bachelor's degree. It can be in anything. You don't have to major in a science. You can do pretty much, I mean, really anything. And actually, med schools now, I do a little bit of med school admission work. Med schools are looking for very diverse undergraduate majors. They actually like it when people major in Egyptian studies or things you wouldn't think would apply to medicine, because a big part of our job is connecting with people. You basically have to make somebody trust you in 10 or 15 minutes and tell you their entire life story. And in order to do that, you need to be pretty well-rounded and be able to talk about a variety of things. So an example today, I can give you actually a real life example from today. So my day today started, and I had a patient who I met in my inpatient program, and I had never seen his face because of COVID, we're doing a lot of telephone and video visits. And so I had never seen his face, but we had talked on the phone, and he left my inpatient practice and went to a halfway house because I do addiction work. So he was in a halfway house and he came to my outpatient practice, and I actually got to see him today on a video call. So we kind of met each other for the first time via video today and saw what we looked like. And we started talking. And so I am a 48-year-old, like white, suburban, upper middle class mom, right? Also a doctor. He was a 24-year-old Black inner city kid, well, kid to me, boy, man, I guess. You would think we have nothing, recovering heroin addict. You would think, really, what do we have in common, right? So I said to him, what have you been doing since you got out of treatment? And he said, well, actually, I've been going to the gym a lot. And I said, oh, I go to the gym. Like, what do you like to do? And he said, I like to weightlift. I said, well, I do CrossFit. And we had this whole conversation about powerlifting and the gym and what our favorite exercises were. And I told him I did CrossFit competitions. And at the end of the visit, he said, wow, I never thought my doctor would be talking to me about CrossFit competitions. This was awesome. We completely connected over the gym. Had nothing to do with his treatment, but it allowed me to then talk to him about his treatment and, all the stuff that he needed to do going forward. So, I mean, I think the point of that story is being well-rounded in your background can only help you as you go through and take care of patients, because patients are people and people have lots of different interests. So I went to Cornell University for my undergrad. I did a Bachelor of Science in biology because I liked biology, not because I thought I had to do it for medical school. But I didn't do bio. I really did a neurobiology and behavior major. So we had a thing at Cornell where you could kind of make your own major. And so I did a lot of like psychology classes, and then like what was the biology behind the psychology. So like somebody's schizophrenic, why are they schizophrenic physiologically? That kind of thing. So that was sort of my major. Then I went to medical school straight from college, which isn't happening as much now, but it was pretty popular then. So I took the MCAT, which is what'd you say? Oh, I thought somebody said something. Okay, so I took the MCAT, which is like the medical school version of the SAT, essentially. It's called the Medical College Admission Test, and it's a very broad exam which encompasses a whole bunch of different subjects, including physics, calculus, biology, chemistry, English. So there's a whole bunch of different subjects on that test, and went to medical school. Nowadays, it's actually much more common for people to graduate from college and do something else in between. So the average age of medical students is going up because people are doing Peace Corps or research or just having a job or traveling or whatever between college and medical school. And not everybody is sure they want to go to medical school when they go to college. So they take time off in between. After that, I went to UPenn for med school and matched in family medicine. So when I was in school, I figured out that I liked doing everything. So I matched in family medicine because I wanted to deliver babies, and I also wanted to take care of kids and adults and kind of do everything. So that's what family medicine does. It's kind of birth to death, we call it. So I matched in family medicine on match day. Match day is a day at the end of May where every medical student in the country finds out where they're going for the next years of their residency on the same day. So it's kind of cool. Everybody finds out their job at the same time. Um, Family medicine training is 3 years for the most part. Some programs are 4. We end up training for about 15,000 hours by the end of in residency. So by the end of it, it's about 21,000 hours in total of training between medical school and residency in order to become a doctor in family medicine. Some of the residencies, as you guys know, are a lot longer. Some of them are, 4 years, 5 years, 6 years. So the training is even more hours. So this is my little slide on what is family medicine. I kind of told you, birth to death. You can practice it with or without delivering babies. I delivered babies for about 15 years. It keeps your practice young because then the babies come to see you and you end up seeing the whole family. So I treated, grandma, grandpa, mom, dad, kids, the whole shebang. Like I would have the whole family as my patients. And we pretty much did everything. Anything that walked through the door, we had to be able to take care of. You can specialize. Family medicine is sort of like what they used to call general practice, but you can do sort of almost like concentrations in family medicine. So they have a whole bunch of things called fellowships, which are like extra years of training after you finish your residency if you want to specialize in something. So a lot of people in family med will kind of concentrate in one thing or another. Like they'll train in family medicine, but then have a concentration in sports medicine or pain management. So when they get out, they'll have a regular family medicine practice. If you guys see a doctor, you might see a family medicine doctor. And then they might have a separate clinic where they see people that are having sports injuries. So they do family medicine, and then they have like a subset of their week where they just do sports or sleep medicine or something like that. So that's what all these fellowships are. So for me, I didn't do a fellowship. I just did family medicine, and I was happy doing that for about 15 years. I worked mostly in community health centers. Community health centers mostly serve poor and underserved populations, people with limited or no insurance, or a lot of like working people who don't have access to resources. And their mission is to provide healthcare to people who have a hard time accessing care. I live in Massachusetts. I probably should have told you guys that from the beginning. So I live in Massachusetts, and I was working here before we had universal health insurance. So before that, there were a lot of people that didn't have insurance at all, and we took care of them in our health center. Health centers get grants and money to do that. Now that there's universal health insurance, we take care of people who are underinsured and uninsured. There are still people that don't have insurance. And you can have insurance and go there too. Health centers often have a lot of resources in one place for people that have health barriers. So like people who don't have transportation, they can go to one place and get like their dental care and their psychiatric care and their medical care kind of all in the same place. While I did all of that, I was also teaching. So I taught at UMass Medical School. We provided maternity care at a prison along the way. And that was sort of where I got introduced to providing methadone for pregnant women. So methadone, I don't know how much you all know about that, but methadone is a medication that's used to help people who have addiction to opiates. So we used to treat pregnant women, well, we still do. We treated pregnant women at the time with methadone to help them not use heroin while they were pregnant, because heroin and pregnancy is a bad combination. So we wanted them to be stable on medication before they had their babies. So that was kind of how I got introduced to addiction medicine. In 2014, I decided to stop delivering babies because I had 4 children of my own and they were getting bigger, and delivering babies really wreaks havoc in your life, your personal life, because they come at unpredictable times. And so, as a mom, right, I have to be home or pick my kids up from school or something like that. And the babies don't care. They come whenever they want. So it was getting hard to manage my own life with my professional life. So I chose to stop delivering babies because I wanted to be there for my own kids while they were teenagers and kind of growing up. And then in 2015, I had a job opportunity come my way that was addiction medicine related. And I kind of just made a leap into a completely different career. So I decided along the way, I was doing more addiction work in my own primary care practice, and I was liking it. And this job kind of just fell into my lap. It was a little random, but a friend of mine called me and she was leaving her job and she said, "Hey, I think you'd be perfect for my job." And I said, I thought you loved your job. And she said, well, I have to leave. I have other personal reasons I need to leave. And I said, all right, well, let me check it out. And it just kind of ended up, it was one of those random things that just fell into my lap. And while I was doing that job, I got board certified in addiction medicine. So that was sort of my transition. So now I do addiction medicine. There are two ways you can do addiction medicine. You can do what I did, which was practice it and apply to take the boards, which is basically what I did. You have to do a certain number of hours, 1900 hours of addiction medicine, and you have to be like kind of supervised by someone else, almost like a fellowship, but not in a fellowship situation. So I did that, and then I was able to take and pass the boards, and you have to do some other stuff too. So that was how I did it. Or you can go and do one of those fellowships right out of residency or separate from residency and spend a year just doing addiction medicine in a hospital setting. Which is not what I did, but it doesn't matter. You get the same board certification. So I'm now board certified in addiction and family medicine. I use both. My practice is a little different. I'm on a Zoom. My practice is a little bit different. So I don't work in an office anymore like I used to. I don't see my families and patients the same way. I work now at a addiction treatment facility. So I'm the medical director at an inpatient detox and rehab. So people come to us when they want to stop drinking or using drugs. And if they're using enough, they need to be admitted into a inpatient facility in order to detox in a safe way with medical monitoring and medication. So I kind of manage that. Anytime somebody gets admitted, they have to talk to me about their, medications, and I have to manage all their medical conditions while they're there. Once they're done detoxing, sometimes they stay up to 6 to 9 months at our site. While they're on site, I manage their medical needs. So like their diabetes and their high blood pressure and all that stuff. So that's where my family medicine comes in. I'm still doing medicine. If they get sick while they're there, if they have asthma, COVID, all of that, I'm managing all of that. So there are about 350 beds in that site, and I'm responsible for all the patients there. And then on other days, I have an outpatient practice where I take care of people who aren't sick enough to be in the inpatient, but are taking medication and managing their substance use disorders while they're like working and going about their lives. And they come to see me once a month for medication and stuff like that. And that's a lot more like a regular doctor office. They come in and we have a visit and talk about their medicine and stuff like that. So I kind of do both. So that's sort of my life and my job. This is about my family medicine. Like I said, I'm still a family doctor at heart. I use a lot of my skills. It's just in a little bit of a different way now. I do a lot of coordination of care, which is another big family medicine thing that we do. I take care of pregnant women still. The only thing I really don't do now is kids. I don't have any kids. The youngest patients we take care of are about 16 in our units. So my final thoughts for all of you as you go into your college and career selections, try and have a good work-life balance. Always keep assessing whether your work-life balance is meeting your needs, because it will change as your life changes. When I was without children, my work life looked a lot different than it did when my kids were little, and then it does now when I have kids ages 9 through 17. So it's a little bit different now. And that was a choice I made. I wanted to be around more for my kids. Some people might make a different choice. They might want to be at work more and their spouse may be home more with their kids. It just depends. It wasn't like, because I'm the woman, my husband made me do that. I mean, this was a choice I personally made because I wanted to go to their games and things like that. So I kind of structured my career around my life a little bit. I think the joy of medicine is you're able to do that. It's one of the few careers at this level of education where you can work part-time. You can be, you can be like, all right, I want to be out every day at 2:00. I want Fridays off. I mean, you don't start that way usually, but as you work in your career, you can do things like that. And at the bottom, I put I'm starting classes. I'm actually taking a class which starts next week in biostatistics because we're always learning, and who knows what the next chapter is going to be. I've been doing a lot of public health work since COVID with my town and my town's Board of Health and school committee, and I really like it. So I'm starting to get interested in maybe getting an MPH, which is a master's in public health. Although I don't know that I need a master's degree, I might just take some classes because I can do a lot of the stuff I'm doing without getting the degree, and it's expensive, as you guys know. So that's it. That's pretty much me. I don't know if you all want to ask questions or type questions. I don't know how you're going to do this. There's a lot of people on the meet. So anyway, that's my little spiel about my life. Hopefully some of you have questions about like why I changed careers and stuff, but I can't see them if you're typing them. So, oh, what's something whoa, all right, I'm starting to see some questions here. I'll go into the chat. Okay. What's something I wish I knew when I was in high school? Languages are important. I'm fluent in Spanish, and I found it very helpful as I went through training. It doesn't have to be Spanish, but I think knowing another language is really helpful as you go through a work life. Something else I wish I had known when I was in high school regarding medicine is pretty much what I said in terms of college. Take fun classes, like take things that interest you. Don't worry about, oh, I have to, I mean, if you want to go to medical school, you're going to have to take biology, chemistry, you're going to have to take all the prerequisites, right? But take a major that you love. I mean, that's the only time you're going to have a chance to do that. So if something really interests you, study that in college and don't worry about medical school so much, because even if you don't take all those classes as an undergrad, you can graduate college and do something called a post-bac, which is a post-baccalaureate degree where you take all those classes and then go to medical school. And, doing a post-bac is not going to make you less competitive for medical school. A lot of people do that now. They do, a philosophy major for undergrad, and then they decide as a senior, oh, I want to go to med school. There are ways to do that. You don't have to know right away that you want to go to medical school. So I wish I had known that, because I might have studied. I mean, I had a fun major, but I might have done some different minors or some other stuff in college, I think. Growing up, did I know? Yeah, I'm weird. How did I know I wanted to be a doctor? I am not the norm on that one. I am very strange. I decided I wanted to be a doctor when I was 6, which is very unusual. Most people are not like me at all. So don't take that as the norm. If I asked my colleagues, most of them didn't figure it out till they were in college. But I always like taking care of people. I always want to make people feel better. And I loved knowing how the body worked. Like when I was in 5th grade, I did a project about like how a cell traveled through the human body. I just was always interested in it. When I was in 1st or 2nd grade, I found the section in the library on all the different illnesses. There was like a book on cancer, a book on diabetes. They were about yay thick, like little thin books. And they were not supposed to be for me to read. I think I was like 8. And I read each book, and every book I read, I thought I had the disease. I came down crying that I had cancer or blindness or whatever. And my parents were like, all right, you can't read those anymore because, but I was always obsessed with like medical shows on TV, any show about doctors or EMTs. I was always obsessed with that stuff. I was an EMT actually in college too. That was something I did for fun. Weird, right? Let's see. Do I have any advice for someone who's unsure if they want to go into medical field, become a doctor? If you're not sure, take the major you love in college. Don't feel pressured. You can always go to medical school. You don't have to go right out of college. That's, if I could get anything through to you guys, you're all in high school. So you're probably, 14 to 18-ish in age, right? You don't need to know right now that you want to be a doctor. There's plenty of time for that. I had friends that went to medical school like in their 30s because they did something else and then decided, oh, this isn't for me. I think I want to go to med school now. It is never too late. So I would say don't do it unless you're really sure. That's the best advice I could give you, because it is a huge commitment. I mean, time-wise, you're missing. I have whole chunks of my life that I don't, like, I never saw a movie. There's a whole chunk of popular culture from like the mid 1990s that I was not exposed to. Like I didn't see movies, TV shows, because you're really just so focused on what you're doing. And I'm not saying that to be depressing, because you're like enjoying it. You don't want to be anywhere else, but you're spending 80 to 100 hours a week in the hospital. So it doesn't leave a lot of time for like hobbies and friends. There's a few years time where you're just giving up a lot. And then once you get to be a doctor, it's still 24/7. I work holidays, weekends, not all the time, but it's a calling. It's like it's a calling. It's not just a job, so you have to be really sure you want to do it. because it takes a lot from your life. You're giving up a lot to do it. It's a privilege, and I love what I do, and I'm grateful to my patients every day for letting me take care of them. But you give up a lot too. And so if you're not sure, don't do it. Don't go to medical school unless you're like 100% sure, really. Put it off, like do something else. You have plenty of time. What are some diverse majors I saw in applications? Philosophy. What else did I see? I'm trying to think. A lot of like English, like literature type things, art majors, music. There was a music theory. I'm trying to think of like the non-sciencey ones. Any kind of like language, lots of language, Italian or, those kinds of things, literature. And then, there's a usual, like sometimes you don't usually see like engineering because they're going off and being engineers, but, there's the usual run of science majors, of course, chemistry, biology, etc. Family studies, human development and family studies was a major at my school that a lot of people did medical school from that. Best parts and worst parts of working for underserved, underprivileged communities. Oh, best parts. All the cultures. I learned so much about so many different cultures. I actually learned Portuguese just from listening to our interpreters speak Portuguese to the patients. Because I speak Spanish, it was like kind of cool. I shouldn't say I learned it. I learned some Portuguese. The patients are so amazing and so humble and so grateful. They're not like privileged, entitled jerks. They're just so nice. I just love my patients. Like, and they, I don't know, they're just so appreciative of everything you do. Like anytime you're nice, I don't know, it's really humbling because it's not, especially being a doctor, you usually attain a certain socioeconomic status. And I can tell you guys, like, I did not grow up this way. My father didn't graduate from high school. My mom didn't go to college. I didn't grow up with a lot of privilege and money. And so, being a doctor, even a low paid doctor makes a lot of money relative to the general population. And so working with a population that's struggling to make ends meet on minimum wage is really humbling and reminds you, of everything you have and you want to help and they're just so grateful. It's amazing. I love working with my patients and just cool things. Like my patients from Ghana would bring me like, not that I want presents, but like they would bring me neat things when they went home to visit their family, like, clothing and just food. Sharing recipes about food was really cool. Just sharing of cultural things was really neat. Learning about music and I'm a big foodie, so like learning about different food. And usually the places where I worked were in cities. So there would be restaurants around where we worked that were run by some of the patients. And so they'd be like, oh, you need to check out such and such restaurant or whatever. My friend runs it. The food's delicious. So, I got to try all different kinds of food, which is really neat. And just, I don't know, just hearing about their lives kind of cracks me up sometimes. Like if they play the lottery and win like a scratch ticket or something, like finding out what they do with it always makes me, smile. And just realizing how much you really have in common with people. Like people are people. I work with a lot of undocumented people as well. And so just hearing their stories is pretty neat. It's sad, but just it's interesting, the worst parts, community health centers can be frustrating because there's a lot of bureaucracy and things just move really slowly. So change is hard to do there. Like to get something to change is really difficult. So it can be frustrating. The patients have a lot of barriers. So often they don't come to their appointments on time. And that's frustrating when you're trying to get somewhere. So like, if I need to get to daycare by a certain time to pick up my kid and my last patient strolls in 45 minutes late, it can make me stressed out. It can be really stressful. So those things can be frustrating. And there's never any money at a CHC, like, especially before the health reform, it was really hard to get them care. I would have to be on the phone begging people to do like free surgeries and stuff. Now it's a little bit easier. But what was the most challenging part of medical school? Ooh, that's a good question. I would say taking step one was really hard. MCAT and step one were probably the two hardest standardized tests I've ever taken. I don't know if they're different now, but they were really hard when I took them. The other challenging parts of medical school, I don't like oral testing. So like when they would quiz you in person, I'm not very good at that. I do better with a written test. I'm not quick on my feet with answers like that. So I would always get flustered. I didn't like being yelled at in front of people. That was hard. I don't think anybody does. It was the sleep deprivation you kind of get used to. I think, being separated from friends and family, like not being able to do things was hard. You give up a lot when you go to med school. Do I recommend doing a pre-health path in college? I don't know what that is. I guess because pre-med isn't a major, maybe it means taking the sciences. I'm not sure what that is. So I don't know. I don't know because I don't know what that is. Maybe someone can explain it to me. Because my school didn't have that. We didn't have a pre-med major. You just did your major and then took the prereqs. What's my favorite thing about addiction medicine? So family medicine, you deal with a lot of chronically ill people, right? So I see a lot of like, say, diabetics who don't follow their diet, or like people with high blood pressure who eat lots of salt. They don't listen to you, right? People are people, and it can be frustrating to like see people month after month, and they come to see you, but they don't do anything that you're asking them to do. And you feel like you're not really doing anything, like you're not making them any better. Addiction medicine, people come in literally homeless on the street, using drugs, no family support, no food. And in 2 weeks, they're better. Like they get medicine and they're coming and they're like, hey doc, I got a job. I have a place to live. My family's talking to me. I mean, between 2 and 4 weeks, the turnaround is amazing. People get better so fast. Like these medicines that we're prescribing make such a difference so quickly. It's pretty cool. Like you can literally save someone's life in front of your eyes, almost. That's what I really love about it. And the fact that a lot of my population is young, like a lot of them are in their 20s, teens and 20s. What's hard about it is we do lose a lot of people, like people overdose. And what struck me my first year doing just addictions was how many deaths I had. Because in family medicine, patients die, but not that often. I mean, sometimes you'll have an older person who dies, or, every now and then something tragic will happen, but not that often. Maybe once or twice a year, you might have a patient die, right? In addiction medicine, it's like monthly. I feel like I pretty much have somebody overdose at least once a month. And it's horrible because it's preventable. They're usually young, and they're healthy otherwise. It's just awful. So that's been really hard. How many years of residency would I need for peds? Peds is a 3-year residency, and that's to do general pediatrics. So that's like what I did. I did 3 years. So peds is 3 years. And then if you want to specialize in peds, like if you want to do, I don't know, pediatric, anything, pediatric neurology or pediatric cardiology, then that's an extra fellowship on top of peds. So then that would be extra years. Usually the fellowships for peds are about 2 years for all the specialties. What's the most memorable, interesting experience I've had while working in addiction medicine? Ooh, that's a good one. Let me think about that. Memorable or interesting? I mean, we've had some really unique patients come in. Trying to think of a story. A story I can tell you. I had a patient overdose in the lobby once, and we gave him Narcan and like coated him right on the floor of the lobby, and then he woke up and walked out. So that was pretty interesting because he was literally dead in the lobby, and then woke up and walked out. And our boss came out and was like, wow, that's pretty impressive. Like the guy was literally dead, and then he didn't want to go to the hospital, so he just walked out. So that was pretty interesting and memorable, stuck in my head. Trying to think if I've had anything else. We haven't delivered any babies at detox, thankfully. We do have pregnant women there all the time, but nobody's had a baby yet on premises. We always get them out before. I keep thinking I'm going to catch a baby there, but hasn't happened. How should I decide on a major if I'm not sure what I'm interested in? Oh, that's a good question. I would say go to a college that's not specialized. So my daughter actually, so I have a daughter who's a senior in high school, and we talked about this a lot. Don't pick a school that's like an engineering school, right? Because if you go to just an engineering school and you decide you don't like engineering, you're gonna have a hard time picking or finding something else, right? So if you're not sure what you want to do, pick a school that has that's good in a lot of areas, either a bigger university or a liberal arts college that has a lot of strong majors. And a lot of schools don't make you declare your major until you're a sophomore or sometimes a junior. So depending on what size school you're looking for, you might have time. You're going to have time to try out different classes and really see what you like. So I would say spend freshman year and sophomore year taking classes in a variety of subjects, like take languages, take some sciences, take some, sociology or psychology classes, take some music or art classes, take math, whatever, take one of each thing and see which ones you like the most. And you can do that in high school too. I don't know what your school is like or how big it is, but there's definitely some pathways to that in high school as well. And you can definitely figure out what you don't like first, right? So like, there are definitely gonna be things you don't like. Everybody has subjects where they're like, ugh, I don't like that. So, definitely narrow down, take out what you don't like, and then you're stuck with other stuff and you can narrow it down that way. Is majoring something different than science, i.e. business, make you more likely to get into med school? I don't know about more likely. I mean, what they're looking for is they don't want people who just do science because they think it looks good. Like they want people it's just like college. They want people who are doing things because they like it. And you're going to do well at it if you like it. So don't pick a major just because it's likely to get you into med school. Like pick the major you love and you'll get in because you're going to do well at it and the passion is going to come through. And so like when we interview for med school, we're looking for like, what are your interests? Not, oh, did I do this club and this club and check this box and that box and that box? But like, did you actually like doing it? Did you do only 3 clubs, but like you did them all the time and you made the most out of what you did. And that's more what they're looking for. And are you genuine about it? Like the other thing they look for is how do you relate to people? I mean, this is a people specialty, right? It's like customer service all the time, right? The patients are the customers and they're always right. So you have to be able to talk to people. You have to be able to interact and relate to people. That's really important in medicine. People have to trust you, so if you can't talk to somebody, you're going to have a harder time. Not to say that you won't be able to do it, but it's going to make your road a little harder. There are specialties where more shy people do well. So it's not to say that if you're more shy, you're not going to be able to go to med school. It's just they want to see how you relate to people. I should probably clarify that a little. What else? How do you doctors in general get over the emotional side of working with addiction patients? So I have a list of patients in my head. And I call them my take-home patients. So like, we see lots of patients. It's like anything else. You see people day in and day out. Some people are just like run-of-the-mill, like regular people. And other people you form relationships with and they stick out in your head and you get attached. Even though you try not to, right? We're all people. I get attached to my patients. And so my take-home patients are the ones that I remember years later because something happened or whatever, like we had a relationship for some reason. A lot of times they're the ones I've lost. I have a few that have overdosed that I think about to this day that I'm really sad over. Sometimes we cry. When I was in primary care, I used to go to my patients' funerals or like to their celebrations if I was invited, first birthday parties, things like that. I can't really do that in addiction because a lot of the families don't want their families to know that their loved one is in treatment. So that's been actually really hard for me when somebody dies, right? I don't get my closure either. I don't get to say goodbye. But we talk, I mean, like, so we don't get over it. You process your emotions. You talk to other doctors who go through the same thing. I have a team of people I work with, like a team of really crack nurses that I work with who are awesome, and other clinicians and social workers. A lot of times I'll talk to the social workers because they're counselors. So sometimes, we're also friends, right? We're colleagues. So I'll go in their office and be like, I need to process this patient because I'm really upset about it. We just own it. Like you own your emotions. I mean, I'm a person. If I didn't get emotionally invested, then I wouldn't be a good doctor. But you can't let that get in the way of what you're doing either. You have to be somewhat impartial. You don't usually treat your family or your friends because you can't be impartial. And I'm not friends with my patients. I don't friend them on social media. If I see them in real life, because I live in a small town, so sometimes I run into people, I don't acknowledge, if they say hello, I'll say hello, but like, I don't acknowledge that I know them in any way. it's awkward. Like you can't really be friends with your patients, especially in addiction. It's just too odd. Have I experienced? Yes, unfortunately, I have experienced the death of a patient. I think I just said, sometimes I go to the funerals. I have a couple of patients that I still grieve to this day. I mean, I grieve them just like you would grieve somebody that you lost, that were attached to. It's hard. But it makes me a better doctor, I think, because I also try and learn if someone, so we also have processes in our practice. Like if someone overdoses or someone dies and they're in treatment, we actually review the case, even if they die, at home or not related to what we're doing, which is usually what happens, right? We always review the case to make sure we didn't miss something, or, is there something we can learn from that to take to another patient? Because you want to try and prevent deaths if possible. Do I have any comments about pharmaceutical? Like pharmaceutical reps, or I'm not sure I understand that question. Pharmaceutical drugs, reps, maybe clarify that one for me. How many hours of sleep do I get in medical school? Depending what year. In first and second year, like normal amounts, I would say 7 hours or whatever. Once we hit clinicals, it was definitely less. There were days I had to be at the hospital at 4:30 in the morning, and I was there till 10 at night. So you do the math. It wasn't much. It's a little different now. They have more work hour rules, but you're generally expected to work about 80 hours a week, if not more, and you're studying on your off time. So you don't get a ton of sleep. You're pretty sleep deprived. And you're staying awake all night, every fourth night or so. So like you go to work at, 4:30 in the morning and you come home the next day at, 1 or 2 in the afternoon. And then you go to work again, 4:30 the next morning. So you're kind of there for 36 hours. And you sleep a little bit, but like you don't get a ton. Is it possible to leave practice, be a stay-at-home mom, and return after a few years? Yes. I have multiple friends who have done that. Generally, you keep your certifications. So like you can leave practice, but you want to keep your license and so you want to keep up with your licensing and your board certifications. Because once you let those lapse, it's harder. You can still do it. It's just more of a pain. So most people who do that, they keep their license active and they keep their board certifications going. And then they just return to practice when they're ready. And sometimes certain hospitals will make you do skills evals and things like that. But yes, it is certainly possible to do that. I know a lot of people who have done that. And yeah, and sometimes what they do is they leave practice and they're a stay-at-home mom, but they work at like a free clinic once a month, or like, they moonlight somewhere 1 or 2 times a month just to kind of keep their skills, but they're not really working, for a practice. So they can kind of pick and choose when they work. A lot of people do that. Do I know if going to an international university, coming back to the US from med school is something I know about or recommend? I know about international med school, but not about international university. I would guess that if it's a reputable university, you're not going to have a problem, but I can't say that specifically. I think it would also depend on the med school you're looking to go to. But I think if you go somewhere and do well, and they know your school. So med school is a lot like college, right? So colleges will know, how certain colleges take kids from certain high schools sometimes. Medical school is a little bit like that too. Like they know which colleges prepare people and which colleges don't. So it would depend, I think, which international university you're talking about. So like, for example, you're talking about McGill in Canada, right? Everybody knows McGill is like one of the best schools in Canada. And I think if you went to McGill, you wouldn't have a problem getting into medical school here. If it's an international university that isn't as well known, you might have a harder time. Have I met someone who was in the pharmaceutical field and changed? Yes. So like a farm research, farm reps, like drug reps. Yes, to all of those things. I have met people who've done that and then switched over and gotten into medical school. Is it good that step one's pass fail? I hear it is. I don't know. I mean, I think those of us who are in practice wonder if it's assessing what it should be, but I think for the students, it's great because it makes it easier. Because it's straight up pass fail. We really stressed about step one because the scores mattered. Now they don't matter. You just have to pass. So I think it could probably take some stress off the students. Since I deal with admissions, do I have any tips? Admissions for med school or college? I think for both, I would say be yourself. And because I interview for undergrad as well. And I always tell students, you want to find the place where you fit in. This applies more to undergrad because you have more choice. Med school, you usually don't have a ton of choice. Like you're not usually getting into 10 med schools, you know. For medical school, you usually need to apply to a whole bunch because it's so competitive. Even the most competitive students are only going to get into a couple. So you may not have as much choice with medical school. So my advice for that would be, you know, apply broadly. Do the best you can in college. If you think your application isn't as strong as it could be, take a year or two off and beef it up, you know, do research or do something that you enjoy that would apply to medical school. In terms of the interviews, like I said, you know, you want to just be yourself. Like everybody knows you're going to be nervous, right? But they're really looking for people who are going to be able to interact with patients and do a good job. If you're making it to medical school interviews, you know, you're smart, right? Everybody that's going there is smart. So it's not about, oh, I have to sound smart or be smart. It's about being yourself and really just being as personable as possible. Do I have any advice about becoming an ER doctor or a geneticist? Well, those are two very different careers. So ER doc, you have to really like adrenaline. It's shift work. So usually the shifts are 8 or 12 hours. They generally do about 8 to 10 shifts a month. They often have a lot of, it's either like downtime or like things are crazy. You know, you have to be able to handle yourself well in a stressful emergency situation. You have to not get flustered if like people are yelling and, you know, someone's dying in front of you and your job is to save them. I don't do well in those situations personally. Like I told you about verbal rounds, like I'm not good in situations like that. I can do it. We all have to. When you're in school and residency, all of us have to do, like if you watch TV, if any of you watch, you know, Grey's Anatomy or any of those shows, right? You see them code people and all that. We've all had to run codes. We've all had to do that stuff, intubate people. Like I had to do all of that. I don't like it. Can I do it? Yes. You know, you kind of get this weird calm and you just get in the zone and you just do it. But I don't like doing it. So I never wanted to do it for a career because it stressed me out. You have to be somebody who's really good under pressure if you're going to be an ER doc. And you have to be okay with shift work. The shifts are weird. Like you might work days one week and nights the next week and stuff like that. So some people really like that because when their shift is done, they're done. They don't have any work at home. They won't be getting phone calls at home. They won't have charts to do. So for some people, they really, really like that defined work. Other people just don't like the changing of the, you know, day shift to night shift and all of that. Geneticists, I don't know anything about being a geneticist, so I really can't answer that one. I'm sorry. I don't know anybody who is a geneticist. It sounds like it'd be pretty cool, but I don't know anything about it. I imagine they'd be working in academic centers though. If I became a doctor, clinical pediatrician, it's difficult to get religious holidays off. So once you are, so no. The overall answer is no. If you have particular religious holidays that are important to you, you will find a group of people to work with that make that a priority. So like when you go look for a job, you're going to be like, you know, this is my deal breaker. I can't work, I don't know, Yom Kippur or Christmas or whatever. Like, and they're going to say, okay, well, here's how this works in our practice. We trade it off, or we actually have one Jewish person who always works Christmas and one Catholic person who always works Yom Kippur or whatever, you know, so everybody kind of works that out differently. I wouldn't say it's difficult. You can't usually get every holiday. Like I can't get off Thanksgiving, Christmas, and New Year's in the current job that I have. It would be very hard. I guess I could, but it would kind of be like an asshole thing to do, to be honest, because then that means everybody else is working Thanksgiving, Christmas, and New Year's, right? So like you kind of split it up just to be equitable. And it's the same with like school holidays because all of us have kids. So we all try and like split it up, you know. I wouldn't be like, hey, I want February break and April break, and I want 3 weeks off in the summer. And, you know, you kind of have to work with your partners and figure out what works for everybody. And, you know, usually it's equitable, but you certainly can find a practice where you can do that. The one thing you wouldn't do is be in practice by yourself. Because if you're in practice by yourself, you're on 365, 24/7. So that would not be what you want to do if you need religious holidays off. In terms of residency, residency training also, there are definitely, they have to follow religious holiday exemption rules. So there are residencies where if people are very devout, so for example, like if you're Jewish and you're very devout and you don't work Sabbath, like you're off, whatever. I think it's Friday night to Saturday night, or is it Saturday to Sunday? I can't remember. But anyway, people get off for that time and they have to honor that because there's laws about that. So if there are holidays that are particular, and you're very devout in your religion, they have to honor it in residency and work around your schedule. But you'd want to tell them that like up front, right? You don't want to get there and then be like, oh, hey, by the way, I need every Saturday off or Sunday or whatever. How did sleep deprivation in med school affect my health? I gained weight, which sucked because you can't exercise because you're so tired. But other than that, I was young. So, the weight came off and I was fine when I was done. Otherwise, it didn't, because it wasn't long term. It didn't really affect me all that much. And it comes in spurts. Like you might have 2 months where you're like super sleep deprived, and then you do an easy day rotation where you're getting normal sleep. So it's not like all the time that you're sleep deprived. It kind of comes in spurts. Residency was a little bit worse, but even that was like in spurts. You'd have some months where you slept and some months where it was like less. And you just learn to take naps, take a lot of naps. You just sleep when you can. Advice on pharmaceutical reps and drugs. Okay, so this goes back to that farm question. Have I met someone? No, that was the other one about that. Hold on a minute. Let me see. Do I have any advice or comments about pharmaceutical reps? In terms of dealing with them, so I've been in places where we're not allowed to talk to them, and I've been in places where we are allowed to talk to them. I think if there's a new medication on the market, they're handy to have around because they can get you the med and samples. There are loads of studies showing that pharmaceutical reps influence doctor prescribing practices, especially when they come to you as a medical student or a resident, because what you learn there is kind of how you prescribe going forward. I personally have found that like insurances dictate how I prescribe more than farm reps, because if a med isn't covered by an insurance, then I can't write for it. And if my patients all have a certain kind of insurance, then I'm going to prescribe certain meds less. So, I mean, I don't think farm reps are the devil. I don't interact with them a ton. Sometimes I use them for things like if I need information on a product or whatever, but I try not to waste a lot of time talking to them, to be honest, because I don't have time to talk to them. And we're not allowed to take things from them now. Like we can't take, when I first started training, they used to take us out to dinner and all that. Like we can't do that anymore. Can't even take a pen, like nothing. So I get info for patients sometimes from them that they can be useful for that. And then drugs. So pharmaceuticals in terms of drugs, I'm still not clear on that question. Like which ones I use, or I don't know. I'm not sure about that one. Do I have to take tests every few years to keep a license? Yes. So for both of my boards, so now I'm double boarded, which means I have 2 pathways to follow, which is just fantastic. If you can't hear the sarcasm there. We have to do a certain amount of continuing education every year, and it's specific also. So my state requires specific things for me to keep my state license, specific training things I have to do. Each board, so family medicine and addiction medicine, each require certain things I have to do every year to keep my license active. So I have to do so many credits a year in addiction and so many credits a year in family medicine in order to keep my license active. And not only that, they're like specific things I have to do. And then I have to take an exam every 10 years for each of my boards. So like each of them, I have to recert every 10 years. Family med is changing theirs a little bit. Like you have a choice of either going for like a 1-day exam where you go to a testing center and just sit down and take the test, or you can do this longitudinal thing over like 3 years where you take like 25 questions every quarter or something. I don't really know because it's new and I don't have to do it yet. So I haven't paid too much attention, but I'm going to have to figure it out at some point. But I've recertified for family medicine a couple times now. That's how old I am. So, and it stinks. I hate it. And addiction is going to be horrific because that's harder. It's a lot more pathophysiology and like receptors and stuff. But I did it once. I can do it again. They have courses you can take and stuff because it doesn't, like the stuff they ask you doesn't actually apply to what you're doing in real life. It's sort of silly. It's a money grab. Does going to an international university, international med school work as a doctor recommended? So if you go to an international medical school, it is harder to get into residency. So if you can get into a US med school, you're better off. It is much harder to get into residency as an IMG, international medical graduate. You can do it, but it makes your pathway a lot harder. So if you can get into a US med school, you want to go to US med school. Not because the med schools are worse necessarily. It's just that's the way it is here. It's just harder. What types of classes taking in high school? Okay, so if you're interested in peds or family med, take if you have like, well, I don't know what your school offers. If you have any kind of classes in like adolescent psychiatry or psychology classes are good. Any kind of child development classes would be interesting. If you have like health pathways in your school, I mean, I don't know what your school offers. So, you obviously you want to take, I would say if you're thinking about med school, try and take biology. Because if you don't like biology, you're probably not going to like med school. There's a lot of biology in it. Or if you have an anatomy class, take that if you're thinking about med school. Because again, if you're not happy with anatomy or you don't find it interesting, you probably won't like med school all that much. There's a lot of anatomy in medical school. So if you're taking anatomy and you absolutely hate it, you might want to think twice about medicine. Not that you shouldn't do it, but think about it, But for peds and family, you want to be able to interact with families. So sociology, psychology, adolescent psych, those would all be good classes to take. Health, but you all probably have to take health anyway. How do I remember all the meds you don't? You remember the medications that you use the most often. When I did family med, I knew a lot more medicines off the top of my head. Now I know fewer, but I know all the addiction medicines. So kind of it's like you took algebra 1 in 9th grade, right? And now you're in calculus. Do you remember all your algebra 1? Probably not, So you kind of look it up. We have books. There's apps now, actually. When I first started, we all had books in our white coats, right? Now I have a phone with a bunch of apps, and all the books are on these little apps on my phone. And I just look up what I need for doses, And if it's a med I'm not sure of, I'll look it up. Or if I'm with a patient, I'll just be like, oh, I just need to check the dose of this medication. Nobody cares. They're fine with it. Do I choose my own hours? So it depends where you work. Some places it's very rigid. Other places you can walk in and be like, and it depends what specialty you're in too, and how much in demand you are. So it's a supply and demand thing. I'm at a point in my career where I literally walked in and I said, I want every Friday off. I need to be out of work by 2:00 every day. I don't want to work on weekends. And they were like, okay, when can you start? But I mean, there aren't a lot of addiction medicine doctors. So I'm lucky. I'm really lucky. I have a great job, actually. My job is perfect for my life right now. I'm home every day when my kids get home from school. I'm home on the weekends. I don't work overnights. But the trade-off is I have to take phone calls all the time. So my phone is always on. I have to review all the patients that get admitted. So every day of the year, I take phone calls from work unless I'm away on vacation. So that's the trade-off for being able to be home with my kids. But it's a good trade-off to me because I remember not being here. I remember delivering babies on Christmas morning and not being with my family, and I love delivering babies, but it was hard not to be with my kids opening their Christmas presents, so it's just what you want to do. But yeah, so you can choose your own hours a lot. And I would encourage you guys as you go forward to really ask for what you want. Don't just take it as a no. You can always bargain. You can always deliberate with your contract because doctors are in demand for the most part. They're going to want you. So especially family medicine, they want us. They need family docs. So you can pretty much walk in and be like, look, I'll work for you, but I want to work 3 days a week and I want 12-hour days. Or I want to work 4 days a week and on Thursdays, I want to be done at 3:00, but I'll work through lunch. There's always a way to compromise, right? Someone doesn't pass their boards, can they keep taking it again? So you have a certain number of times you can do that before you have to stop, before they say, no, sorry, you're done. But yes, you can take it again. High schoolers who are applying to college and have an interview. Oh yeah, don't be nervous. I do these interviews. Usually they're very casual. They're going to want to know about you. Make sure you read about the school before you do your interview. Have some good questions for them about their school that are school specific. So not just in general about college, but about their school. If you're applying to their school in international relations, another good major, by the way, in international relations, make sure you read about their international relations department and know something specific you want to do there. I just interviewed two students last week from my university, and both of them knew specific research projects that were going on at my school, which I didn't even know about. But they were like, oh, I'm interested in working with so-and-so. They're doing genome research and blah, blah, blah. And I'm like, oh, wow, you really looked into this. That's great. So know something about the school. I think that's really helpful. And just like be yourself. Tell them a little bit about you. Like most of the time we don't know anything about you. At least for our school, all I find out is where you go to high school and what major you're applying in. That's it. So I always start off with like, just tell me who you live with. Like, what do you do when you're not at school? You know, what kinds of things do you like? What kinds of things don't you like? What's your like least favorite subject in the school? Like all those things to let us get a sense for who you are. Is it necessarily good? Yeah, I mean, it's helpful to be good at memorizing in order to be a doctor. There's a lot of memorizing, but it's not all memorizing. So you don't have to be good at memorizing. There are ways to learn medical things without having to memorize everything, especially now with everything on apps and stuff. They do a lot more. It's a lot of critical thinking. What you have to do is be a good problem solver. Like if you like logic problems, you have to be able to like take pieces of a puzzle and kind of put them together and solve the problem, right? Because each patient complaint, that's what basically they're doing. They're giving you symptoms and you're kind of like, all right, there's this symptom and that symptom and they go together in this way and maybe this is the problem they have. How am I going to figure it out? Like if I think they have this problem, what tests would I do to figure out if it's this problem or that problem, you know? So it's a little bit more like that. So I mean, being good at memorizing helps, sure. If you got a photographic memory, I mean, it's going to be awesome for you, but you don't have to be. Is pharmacology a difficult topic? Yes. Well, it depends. Yes, in some ways, but it's like anything else. If you're able to learn about it and understand it, it's not as difficult. I found other things more difficult than pharm. I kind of liked pharm, but everybody has their things. What specialty has a difficult work-life balance? I would say cardiothoracic surgery, transplant surgery, as those are like on demand specialties, right? Somebody's having a heart attack and they need heart surgery, they need it like right then and there. Same for transplant. Transplant surgery is actually something I was really interested in, but I saw the surgeons living in the hospital and I was like, I can't do this. You know, it's a very rewarding specialty, but it wasn't for me personally because I knew what I wanted out of life and I didn't want to just be a doctor. I wanted like other stuff. So yeah, I would say certain surgical specialties are difficult. But any specialty can be difficult if you make it difficult, right? If you live in the hospital all the time, then you're going to be making it difficult. I think that's the last question. Wow, I got through all of them, you guys. Those are all really good questions. Thank you.
Thank you so much for speaking. That was
I
really
feel like I've been
interesting.
talking for so long. It's so awful. Like no one got to talk to me. Like
I'm gonna send a little Google form in the chat so you can fill that out just to make sure like your attendance is counted for everyone at the meeting. But thank you so much for speaking with us. That
You're
was really
welcome.
helpful.
Thanks everybody for coming and listening to me talk for an hour. I feel kind of bad. Normally when I do things like this, it's like interactive. This Zoom thing is like not as much fun. But I hope that I gave you some useful information. Feel free to share my email, Olivia, if people have other questions and they want to email me. That's fine. I'm happy to email people. I'm sure you have lots of doctors popping in and out of your meetings, but I'm happy to email people if anyone ever decides to come east. Is it freezing over there? Did you guys get any snow? Yeah.
Yeah, it's pretty cold and snowy.
Is it? Yeah.
But it's a lot better than normal, though.
It's better than normal? Yeah. Yeah, it's not as cold here as it is there. We had some snow today, but just about 5 inches, not a big deal. We get lots of snow too. I mean, not as much as you guys, but we're used to handling big amounts of snow. I live right by a ski mountain, so we got a little bit of snow. But anyway, well, thank you guys so much. It was nice talking to all of you and seeing some of you. You got a whole bunch of people in your club. How big is your school?
We have 4,000 people.
Oh, wow. That's a huge school. You must have tons of course offerings then. That's fantastic. So my kids go to a tiny school. The graduating senior class is about 190 people. It's like a rural little school. So completely different than I'm sure what you guys have. With 4,000 people in your high school, you must have a ton of pathways for all of this. That's great. That's really good. Tons of AP classes, right? Go fun. All right, well, have a good night, everybody.
Thank you.
Thank you.
You're welcome.
Thank you.
Thank you.
Bye. You're welcome.